Namaste friends, welcome to the second episode of video on varicose vein. This episode we will go through the journey of understanding and diagnosing varicose vein as per Ayurveda and contemporary science. Let's begin.
Whenever the varicose vein comes, the first thing we need to see about the circulation. The circulation involves whatever the blood go out of the heart and then how it reaches. The whole circulation is there. In between, we need the channels. That's the artery and veins. So the conversion which is happening is capillaries. So the blood which comes from the heart, which reaches the arteries and then the capillaries and then the veins and then the heart. So this is a complete circulation. In that, whatever the variation is happening, that we will have a look. Venous return, like artery, we don't discuss much since we are getting into the varicose vein. So for the venous return, there are factors which are responsible, like arterial pressure. Arterial pressure is required because venous doesn't have pressure. So the arterial pressure once again depend on heart as well as arteries. That includes the pathology which can influence the disease or the healthy condition which reflect in the healthy veins also. The gravity, we know that naturally the gravity, whenever we are standing, there is a pulling action which is happening naturally. So if we can see this in case of piles or the hemorrhoids, where if it reaches the second level or second degree, then it won't be a medicinal, the medicines will not be so useful when compared to the surgery. So let's say invariably everybody is undergoing this pressure. But varicose vein, once it starts, that will be accelerated by gravity. Venous walls, I think everybody knows. These are the block or which can support the venous return. That means not going in the opposite direction. These are semilunar cups-like structures that are present in the veins, which maintains one way, like single way direction flow of the blood. And whenever the blood flows above this, and then they close so that it stops or it prevents the blood flowing backward direction. These are very important for a part of varicose vein as concerned. So it's only a one-way direction what we required. And calf muscle pump, this is a mechanism which is very essential to pump the blood towards the heart. Because whenever the calf muscles works, especially the gastrocnemius, the both heads of gastrocnemius, when they work, they try to compress the deeper veins which are present or embedded in that, so that the blood starts moving up direction, opening the semilunar walls, and then whenever they are not working or whenever they are relaxed, once again the semilunar walls closes so that the backflow of the blood is maintained. And the second one is thoracic. When you look at the thoracic, the respiration it's quite simple, but most of us we look into that respiration only for the oxygen or circulation like that, but it has indirectly has many things. If you just consider the abdomen in case of respiration, whenever the inhalation happens and exhalation happens, there will be negative pressure which is created in the abdomen. So that means you can see that it's like a piston, it is acting. So it's something is pulling and pushing, pulling and pushing. So this is what happens when the blood reaches to the inguinal region or inguinal vessels, inguinal vein, through the pumping mechanism which is done by the calf muscles. Then further lifting has to happen only in the presence of proper respiration. That means the diaphragm as well as the whole respiration which happens, abdominal breathing and chest breathing, that is something which is helping for the upliftment or just upward or pushing movement of the blood towards the heart. So these are the two indirect mechanism which is happening, because heart is more active where it can pump the blood, but these things are having primary functions, but the secondary functions is helping for the venous return as a pump. Looking at the venous circulation, we need to see the veins, that there are deeper veins you can see here as well as superficial veins. This is the separation. This is the muscle layer where the deeper veins are there. Above the muscle layer, which are visible below the skin or the dermis, that is the superficial veins. In that you can see this is capillaries, and then reticular veins, and then it goes to the superficial veins, and then it is drained, that is the blood is drained to the deeper veins, where it starts pushing towards the upper side if the calf muscle or the pumping mechanism of the calf muscles happens properly. If there is any variations, that will lead to the varicose vein. We need to see that these perforator veins, they are not in the upward direction, they are horizontal, or they are like maybe slant up or down depending on the anatomical structures area. These walls are in the horizontal level, so it's very easy that there will be a perforator incompetency which can be seen naturally because it's easier. Whenever you see up and down, then naturally you have the pressure to hold it properly, but whenever it is in a horizontal, it's easy to pushed by the pressure which is created by the backflow, or if the calf muscle is not functioning proper, then the blood circulation or the blood which has to move towards the deeper veins will be reduced by its quantity. That leads to backflow gradually. And this all we know that there are like superficial plantar veins, and maximum we know that easily that saphenous vein, small saphenous, great saphenous vein, these are the superficial veins. The deeper are tibial, popliteal, and then it goes to the iliac and this. So here we need to always keep in mind that varicose vein can happen in superficial and perforator veins maximum. Deeper veins we don't get them because the muscle will have the natural strength to hold them to a proper position, but it can happen. If we are looking at the causes for the venous sufficiency, the main causes will be the blood clots or the venous varicose veins. The blood clots means whatever the pathology involved into that, the whole set of things will come into that. Other risk factors, if you are looking at abdominal pressure, as I told, the respiration has to happen where the abdomen has to move properly. That means whatever the pressure or whatever the things which can interfere in the respiration or in the abdominal movement, that all the causes are included as a part of the causative factor. Mainly when we are lazy, that's the thing which we lack of exercises, and that will lead to the obesity or the increased body weight. Constipation, maximum patients we are seeing nowadays, it might be because of we started using the commodes rather than the Indian way. Last time also I was telling that if we start using the Indian way of toilets, that's a push and pull mechanism which happens. That's simply that the right thigh, when it pushes to your ascending colon, and the left thigh when it pushes to your descending colon, there will be a pressure exerted towards the lower side, towards the rectum, where there will be easy opening of the splinter and you will evacuate properly. If not, then we start pressurizing. That will lead to the hemorrhoids or other complications which are there naturally. And pregnancy, which is not a pathology, it should be a physiology, but nowadays it has become a beginning, or it has become a cause for multiple diseases also, or conditions. Smoking, atherosclerosis or DVT. The reasons are multiple for the atherosclerosis. It can be age, and similarly the DVT can be by the smoking or any other things. And sometimes muscle weakness which happens because of the disease, or if the lacking in the physical activity. This is very important. Injury. We might be seeing in the patients who have multiple crush injuries or met with an accident, went for a major surgeries, where the lymphatic drainage as well as the venous drainage will be hampered. Because in the accidents, the most importance will be given to align the bones and set right the muscles, because circulation can happen collaterally, so that there is no much importance for that. So that might be a triggering point for some of the cases which we are seeing. and phlebitis conditions which can happen, and the family history which is there in the maybe the genes, or lead to the cancer conditions which are maybe the probable cause for the venous insufficiency. Let's know what is the varicose veins. It can be a dilated condition of the vein or tortuous condition, that is twisted or turned veins like this which we are seeing in the image here. So it need not be a twisted like this. It can be a, like we can say that Sira Darshana. It's naturally we can say in the Vata Prakriti person. But if it is abnormally seen, that means it was not there prior, now we can see that. That is where we need to consider into the beginning of the varicose vein. Here we can see that same thing in the spermatic veins also, where we see this is one of the patients we are treating now. We need to see how it goes on. Just a few days back we started the medications. This is a 11-year boy. So this also comes under varicose vein. Similarly, if you are looking at esophageal veins, that is esophageal varices. It's a common condition which happens in the liver diseases as a secondary complication, especially cirrhosis of liver. This can happen. So that's also varicose vein, but there it's not the there is not much importance for the vein pathology. It's because of the pressure which is created by obstructing the flow towards the portal circulation. Similarly, the hemorrhoids which we discussed, that's also veins only, varicose veins only. When you look at the natural causes for the varicose vein, or why varicose vein happens, what's the defect in the veins, or because naturally when we look at them, they don't have any pressure, because they don't have pump. As I told, heart is the pump which is there pumping the blood in arteries, but in case of veins we have only a secondary function is pumping by the diaphragm or the abdominal breathing and calf muscle. So there is no prime thing which can support that. And if you are active physically, or if you are moving, then only the calf muscle will work, where that pumping will start. Of course, we all respire, so there is nothing that there is no condition where we don't do the respiration, but that has influence, as I told, the abdominal causes which are there. And here we can see that whenever somebody is standing for a long period, there will be a low pressure. When somebody moves, their pressure builds up. So there should be an activity where all the activities are done together, sitting, standing, and lying down or resting. So one after the other has to happen simultaneously. Otherwise, anyone, if you sit for a long period, that also be a causative factor. If you stand for a long period, that definitely lead to the causative factor for the varicose vein. Gravity, that we discussed already, and collapsible nature of the venous walls. As we know that there are three layers in the vessels: tunica, externa, media, and interna. The media, that's a muscle layer which is much more weaker. That means it's not pathology, it's naturally it's much more weaker, so that there will be elasticity. That's a nature done, because 64% of the blood is carried, or the volume is there in the veins. So that's a natural phenomenon. It is weak to carry or hold the blood, but if it is unable to move it properly, that will create the heaviness or pressure, which will turn to venous wall defect or the structure defect in the veins, which we can see. And as the aging process, atherosclerosis can happen. That's one thing which can accelerate the process of varicose vein. Mainly we can see that varicose veins in the, like in occupational hazards. In most of the jobs or the present lifestyle offered jobs are there, they're all susceptible easily to form, be the patients or culprit or get disease with the varicose vein. I think the images are self-explanatory. So any post, like commonly we can see that security or sales, petrol bunk, teachers, police, carpenters, laborers, doctors, nurses, many we can see that. And looking at the pathophysiological aspect of chronic venous insufficiency, the primary cause is the muscle pump failure, which I told, the calf muscles. That means if you're standing for a long period and if you're not doing enough exercises, that will be the primary cause. Venous obstruction, which can happen because of the multiple things, and venous valvular incompetence in perforator vein or superficial vein or deeper vein. So these are, one is always related to another. If there is a perforator insufficiency, that will be creating a pressure over the superficial veins. If there is a deep, that will create a perforator pressure and then the superficial. So any one hamperment, it will lead to the others, but gradually it depends. It's not all of a sudden it happens. Looking at the symptoms of the varicose vein, the main common things which we see is starting heaviness or feeling of little bit swollen up or tightness in the evening. This is something which we feel that. Calf muscle cramps can be seen, and swelling. Swelling itself is inability to drain the blood from the area. So that means there is already started the incompetency in the veins. It can be due to the lymphatic circulation also. If there is a stagnation, definitely the itching will start, and then discoloration, and then varicose vein. Varicose vein and discoloration can happen one after the other or together. There are different presentations. Some of the patients we could see there is a varicose vein always before the discoloration, but some of the patients we can see only the discoloration. Discoloration, when we see, most of the time it is more deeper vessels which are deeper vein which is involved. Whenever we see the varicose vein first, that is either perforator or the superficial veins, that is leading to the discoloration later. And then the venous ulcer, which can happen at the later stage. So any of these symptoms can happen. So the beginning 1, 2, 3, which were like heaviness, feeling pain, cramps and swelling, are the very initial steps. Gradually, when it's set up or when it settled down to form a disease, then we see the itching, discoloration, varicose veins as well as varicose ulcers. When we are staging the varicose vein, there are 5 stages. Spider veins, this is mostly happens in capillaries. That's why we see the beginning like a red color as well as blue color together. That's the very peculiar thing which we can see there. Reticular veins, that's the beginning of the veins or venules. And when the vein trunks are involved, then it becomes the varicose vein, and it lead to the complications like stasis of blood more and discoloration of the blood. That will lead to the chronic insufficiency, which easily turns into the trophical ulcer or stasis ulcer or eczematic ulcers. Investigations which are required, lab tests which we generally do in case of DVT, prothrombin test to know whether there is any clotting factor defects or there is a clotting factor which is hampering or which is started coagulating or dislodging. Radiological investigation, most of the time we go with this. USG, the abdominal causes to find out, maybe a constipation or any other tumor, or sometimes PCOS, PCODs, or lymph node enlargement, or if somebody has a lot of bloating because of many other reasons. So that can be a cause that we can look into the USG. Doppler, venous or arterial study, sometimes both are required. This is something which is helpful. As I told, if arterial pressure is reduced or backflow is seen, or we can say atherosclerosis is found in the arteries or blockages in the arteries, that will reduce the venous pressure. So that will also become indirectly causative factor for the varicose vein. Most of the time we write for the venous Doppler. If nothing is found out, then we need to look into the arterial. Venography or magnetic resonance venography, it's not, normally we don't write it too much for this because there is no as such pathology which is needed for the treatment for varicose vein. But if it is in that DVT is there, then we might need this.
Thank you for watching. We will come up with the next video on varicose vein management and preventions.